To be honest with you, I'd be laser focused on the clinician burnout issue. You have the 15,000 workers, nurses right now striking in
Oh,
Minnesota.
yeah.
That whole area of what can we do from a technology perspective to lighten that load?
Yeah.
I'm not saying it's the only answer. Clearly, there's labor rates, there's all sorts of issues, number of patients they have to oversee, 2 full years of the pandemic that they've had to deal with. And as much as it depends on me from a technology perspective, what can I do to alleviate that problem? Those are some of the things I would do as a CIO. Where would you be focusing right now?
It seems like every time I'm on, we sort of talk about this. I'm a Toyota production system guy. And so a lot of this comes back to people, process, technology. And so while it sounds good and feels good to say we're going to take some pieces of that work that whoever, nurses or anyone is doing, and is there a way to automate that? A lot of that sort of ties back to, is there standard work? Are there standard processes that we could look at to automate? So there's probably a couple of pieces there. One is before you would spend the money on the technology to do automation, do you have processes that are automatable? And so that requires a lot of work, not from the IT team, but from management engineers who don't exist at a lot of healthcare organizations, and business, clinical, and research operators who decide that they want to create standard work that they can then apply a technology solution to. It sounds simple, but it's a lot of really hard work. It's always a great place to focus because what you want to do is to try to keep those really expensive staff assets, as we say so often, working at the top of their license. Take as much off of them as you can. The other way to think about this might be a lot of health systems and a lot of group practices, we've given physicians scribes to do a lot of the not fun, not really interesting, but somebody has to do it kind of work with the electronic health record. Maybe that's a way to work through the process of, is there some sort of a scribe for nursing? Is somebody doing that?